Diabetes or diabetes is a group of metabolic disorders characterized by persistent high blood sugar. Symptoms include frequent urination, thirst, and feeling hungry more than usual. If left untreated, diabetes can cause many complications, including acute complications such as ketoacidosis, hyperosmolarity, and death, as well as chronic complications such as cardiovascular disease, stroke, kidney disease, foot ulcers, nerve damage, eye damage, and cognitive decline. To help patients control their blood sugar and prevent complications to a certain extent, we have made an effort to find effective treatment methods. In addition to using Western medicine, here are 10 natural folk remedies that can reduce blood sugar, helping you have a healthier lifestyle. Please watch the following video. 1. Benefits of apple cider vinegar. Scientists have also proven the benefits of apple cider vinegar for people with diabetes. According to a study published in the American journal Diabetes Care, a group of insulin-resistant people, after drinking water mixed with apple cider vinegar for a period of time, were able to stabilize insulin levels and increase insulin sensitivity. Scientists found that people who drank apple cider vinegar had lower blood sugar levels in the morning than when they drank water before bed. The results showed that lower blood sugar meant lower insulin levels. Ingredients and how to make apple cider vinegar are very simple, including apple cider vinegar, 4 tablespoons, honey, 2 tablespoons, cinnamon powder, 2 teaspoons. Add apple cider vinegar, honey, and cinnamon powder in the recommended amount to 1 cup of boiled water. Stir well to form a mixture and drink. Use this mixture after every breakfast for at least 3 months. Patients will definitely see much better progress. 2. Fiber and barley. Several studies have found that people who eat a high-fiber diet have lower levels of C-reactive protein, CRP, in their blood. CRP is a marker of inflammation that has been linked to conditions like rheumatoid arthritis, heart disease, and diabetes. When you eat fiber, it takes your body longer to break down food. This helps keep your blood sugar levels more stable. This makes fiber especially good for people with diabetes. Eating fiber reduces blood sugar and insulin levels. The recommended amount of fiber is about 30 grams per day. The best way to reach your goal is to eat vegetables. Barley is a high-fiber, high-protein grain that has a lot of data to support its role in helping improve blood sugar, insulin, cholesterol, and overall inflammation. There are 2 types of fiber, soluble fiber and insoluble fiber. Water-soluble fiber is abundant in beans such as soybeans, kidney beans, green beans, vegetables, fruits, etc. Soluble fiber will absorb moisture, making stools softer and easier to pass. Water-insoluble fiber such as wheat, unmilled grains, vegetables. This fiber absorbs water, increasing the mass of waste, making the process of eliminating waste faster. Insoluble fiber does not absorb moisture, but speeds up the movement of food through the intestines. Studies also show that eating whole grains can reduce the risk of type 2 diabetes, high blood pressure, and heart disease. They are also a source of food for beneficial bacteria in the gut microbiome, helping to reduce inflammation in the body. 3. Benefits of zinc. Using zinc to prevent diabetes from developing. Laboratory studies have shown that zinc acts like insulin when introduced into insulin-sensitive tissues, and it appears to stimulate insulin action. It binds to insulin receptors, activates insulin signaling pathways, and more, all of which lead to glucose uptake by cells and the clearance of glucose from the blood. Zinc is also required for proper processing, storage, and secretion of insulin, and it may protect against beta cell loss, a hallmark of diabetes. Because zinc is closely linked to insulin action, zinc deficiency has been linked to poor beta cell function and higher rates of insulin resistance. The recommended daily dose of zinc is 12 milligrams for women and 15 milligrams for men. In some cases, your doctor may prescribe more than this. Zinc supplements are available in many forms: tablets, effervescent tablets, and zinc lozenges. In particular, lozenges in the form of zinc gluconate salt are a rich source of zinc because they are easily absorbed. 4. Exercise regularly. A very effective way to treat diabetes at home is to develop a regular exercise routine. When exercising, muscles use blood sugar to create energy and contract. Physical activity helps people with diabetes control their weight and increases insulin sensitivity, meaning that cells can use blood glucose more effectively. In addition, physical activity also helps reduce the risk of cardiovascular disease. People with diabetes can choose from many sports such as jogging, swimming, walking, yoga. You should measure your blood sugar before and after exercise to find the sport that best suits each person's condition. Weight control, overweight, obesity is one of the high-risk factors for diabetes. Therefore, weight control is also an effective step to support diabetes treatment at home. Diabetics with obesity only need to lose 5% of their body weight to help improve blood sugar control, reduce the need for diabetes medication, and improve quality of life. 5. Nopal cactus. Deserts, sandy sun, tumbleweeds, and sharp thorns. That's what comes to mind when people think of cactus. Nopal cactus, also known as bunny ear cactus, is one of the staple foods in Latin America. They provide a significant amount of fiber to the body, reduce cholesterol and blood sugar levels, and prevent the risk of diabetes very effectively. Eating cactus leaves will help reduce blood sugar levels in obese or diabetic patients. A study by the University of Vienna on 24 non-obese patients who ate cactus leaves showed that their blood sugar levels decreased by 11%, proving the therapeutic effect of cactus on diabetic patients. Cactus dishes are easy for diabetics. Have you ever seen nopales cactus at a Mexican restaurant? It is now a favorite dish, and rest assured that you are choosing a food that helps lower blood sugar. Nopales are the accompaniment of the prickly pear cactus, and when cooked properly are delicious. Great with eggs or salads. The fruit can be eaten raw, whole, or juiced, and can be made into jams and jellies. We highly recommend the nopal cactus for diabetes prevention. Most supplements typically recommend at least a dose of 500 to 650 milligrams per day. More research is needed to determine the exact daily dose of nopal supplements. In addition, the nopal cactus has many effects such as protecting nerve cells, rich in antioxidants, treating prostate enlargement. Nopal cactus has antiviral properties, especially against herpes simplex virus, HSV, respiratory syncytial virus, RSV, and human immunodeficiency virus, HIV. Thank you for accompanying this video. What we want is to bring joy and health to your life and your family. We hope this video is meaningful and helpful to you. Thank you and see you again.